Now, did you know that toenail fungus affects nearly 1/3 of the Irish population, and if not untreated can actually lead to some serious damage? Now, here to tell us more about this treatment, the laser treatment, is Marie Walsh from A New Therapy in Drogheda. Good morning to you.
Good morning.
Now, tell us about the toenail fungus and the causes.
Okay. Generally what causes the fungus is everywhere in the environment, so they're very easily picked up, the infections. The most common areas, I suppose, are athletes, running shoes, locker rooms, swimming pools, places like that would be the most common places to pick them up.
Now, I know I picked a bit up in the gym, and basically I went on the tablets, Lamisil, to clear it, but it is very hard on your liver and your stomach. So, although it does clear it, you have to be careful about that.
That's one of the problems with the oral medications. There's two out there, the Sporonox and there's Lamisil. There's only a 50% success rate actually with taking those, and you can only take them once. You can't have a second dose of it if it doesn't work. Whereas the laser is very safe, it's very comfortable, and in clinical studies, they've had an 85% success rate in just one treatment.
Now, I suppose people will say, though, there is sort of over-the-counter treatments in chemists where you don't, if you don't want to go for treatments. Tell us about them.
They're very slow to work. You can have the nail lacquers that are applied onto the nails every day. You'd be doing it for maybe 12 to 18 months. There's only a 10% success rate with that then as well. Okay.
Now, tell us literally, there's household remedies as well, isn't there? Sort of, you have these old housewives remedies about, is it baking soda and things like that?
Yeah, things like that, yeah, but I'm not too sure how well they really work.
Right. Now, what are the dangers if you don't get something like this treated? Look at these nails here, and just so people at home, to show them what they should be looking for. It's the yellowing and discoloration of the nail.
It'll start off looking like little white or yellow spots in the nails, maybe a little bit of discoloration. It might be mistaken for like tan, discolouring the nails, so keep an eye on it. Then as it progresses, if it's not treated, it just gets worse, it gets deeper into the nail, it can become painful, you could actually lose the nail then as well.
And is that the danger, that you actually become and lose the nail?
Yep, and the other danger as well is it's so highly contagious, you can pass it to everyone else in your house.
All right. Okay, so what are you doing here now?
So what we're doing here now is I'm just heating up the nails.
Just maybe move your hand there so we can see it.
So we're heating up the nails here, so we need to heat it. Fungus will be killed off at 44 degrees.
Right.
So this treatment will take it up to about 50 degrees to ensure total destruction of the fungi.
So basically that laser is heating the nail up to that level?
It's slowly heating it up, so it's very, very comfortable for the client to have it done. We did it on the back of your hand there earlier on, you felt nothing virtually. So you feel a very slight hot pinch at the very end of the treatment, and that's when you know that you've brought it to the right temperature. And then that should... Now, you were saying to me earlier on that there's about an 85% success rate in this, that clinical trials have proven. That's correct. That 85%. So when you get it done once, what happens? Does the nail start to grow out? Exactly. We will put a little notch in the nail so that we can watch the growth. We'll bring you back in about 8 to 10 weeks after the treatment, and then we can see the progress. If you need a second treatment, then we can do a second treatment. But yeah, 85%. So basically, when you do it once, the nail, that kills it off, and then the nail should grow out then itself. Nice, new, clean, healthy nail will start growing out then behind it. Okay, we have a before and after shot here, just to let people know that you might want to turn away. There's the before shot. If you're having your cornflakes or your bacon and eggs at this time, and don't look at it. There's the before shot. So the after shot now, if we bring it up, you can see the new nail is halfway down. Yeah. So the old fungus nail is coming out, and that new nail is growing there. So that's basically what will happen. Exactly. Or hopefully will happen. Hopefully what will happen, yeah. Okay. Now, obviously, how much does this cost then, people? Normally this treatment is €300 to have a session done. We're doing an offer today for all the Ireland AM viewers, and we want to make the treatment open to as many people as possible, so we're doing it at half price, so it's €150. So €150. How long would the treatment last? It takes about 15 minutes to actually do the treatment.
15?
15
Oh,
minutes.
is that
that's
all?
That's all.
Okay.
Yeah, it's very quick.
So for 15 minutes, you should be able to then, the nail should be completely clear, as in the fungus is stopped and your new nail starts to grow out.
Exactly.
How long would a new nail take maybe to grow?
It could take about 12 months for a big toenail to fully grow out. Yeah.
But you've started the process.
Exactly. And 24 hours after your treatment, you can paint the nails, so nobody knows that you've had a treatment done. It doesn't look any different, doesn't feel any different.
And of course, the thing is, you can catch it again, can you?
You can catch it again. So you need to make some preventative measures, as in using antifungal powders in your shoes once a week. You can apply antifungal creams that all can be bought over the counter in any pharmacy to prevent it.
Okay.
And just practice, good hygiene with your shoes and socks.
Okay, well, there you go. There's, you saw the half price from a new therapy laser and skincare clinic there in First Street in Drogheda in County Louth. And Marie, thank you very much for joining us this morning.